Hello, and welcome to One World, One Health, with the latest ideas to improve the health of our planet and its people. I'm Maggie Fox. Planet Earth faces challenges including pollution, climate change, and new and re-emerging infectious diseases, and they're all linked. This podcast is brought to you by the One Health Trust with bite-sized insights into ways to help. A picture is worth 1,000 words, and often, especially in the world of global health, they can distort people's views. In this episode, we're taking a look at how photographs and other images that are used in global health might not always achieve the intended effect. We're chatting with Dr. Esmita Charani of the University of Liverpool and the Division of Infectious Diseases and HIV Medicine at the University of Cape Town in South Africa. Esmita, thank you so much for taking the time with us today.
My pleasure. Thanks for having me on this program.
Esmita, we've all seen pictures of emaciated children being weighed in scales, of women clutching their babies to their chests. Can you describe some of the images that people may remember especially clearly?
So we use images a lot, particularly in global health. And there is a tendency we have noticed over time in our own experience to depict people from the global south through a particular lens. And I mean, the most well-known image, if you like, which isn't actually from global health, it's a journalism image, was Steve McMurray's photograph of Shaibat Gula, the Afghan refugee girl whose photograph made the career of Steve McMurray and was a very, everybody thought, beautiful photo at the time.
And this is the photograph of the refugee with the beautiful green eyes. Her face is amazing. And she has a look of desperation on her face.
Yeah. And it was featured on the cover of National Geographic, and it's become a very iconic image from the war in Afghanistan. But when the reporters went back to find her and tell her story, they realized actually there was another story behind the image, that she was taken out of her classroom to have this photograph taken by a foreign man, a photographer. And she actually, the anger and that emotion we see in the photograph is her not wanting to be there and not having her photograph taken. And so this is the issue of consent, of telling people what we do with their images and how we depict people without telling their stories or narrating a story that is different from the reality. So that's an extreme example, and I use that example because it is well known, and I think most of the listeners will have by now realized which image I'm talking about. But within global health, through our practices over time, we have seen a consistent use of inappropriate and intrusive images of people, particularly if they happen to be from the global south, of people of color, people in low and middle income countries, depicted in situations, in environments that often would not be allowed if those individuals were in the global north. For example, of children in hospital beds, distress, of patients receiving care, of being examined by doctors, and those images appearing in reports by NGOs, by global health organizations to promote the work that they do. And that is what is of concern to us and led us to do the work that we undertook.
And it's almost as if people are being used as props.
Precisely. And people are being used without due consideration for their dignity, for their privacy, and for being given or that there being any evidence of consent of the images of people being used. Private citizens and private individuals whose images are being used to promote the work of NGOs and healthcare organizations. And one of the stark differences, if you take notice, if you look at next time you open a global health report or publication, if you look at the way we depict people from different parts of the world, when we try to present an environment that is from the global north, from a high-income country, often it is staged. It is a very sterile environment and the actors are used. But when we try to depict the same from low middle-income countries, it is often people in real-life situations, vulnerable situations, and without due consideration for consent and privacy. And it's that stark difference in representation of people based on where they are from, which is problematic.
Now, you can say that photographs don't lie, but they don't necessarily tell the whole truth either. How can something like a photograph or an image distort how people view other people?
In global health, particularly in the area where we work in infectious diseases, there is a lot of association of diseases with particular groups of people, and photographs have a powerful means to perpetuate that and lead to stigmatization and othering of diseases, an association of specific populations with specific socioeconomic and sociocultural problems and diseases. And that is something that we do not advocate for, which we think is inappropriate and leads to, it perpetuates coloniality and also stigma and racism and bias in our practices. And another way to look at it, another example I can give you is if you look at the imagery used in vaccination, often it's people in pain, suffering, in distress, and that gives a negative image of vaccines, which are life-saving interventions that actually do a lot of good. So we have to be very careful, particularly in the field of global health, when we are trying to communicate about disease and health and well-being, how we select the images and what those images are telling the audience.
You and your colleagues recently wrote a paper published by The Lancet looking at this problem. What did you find and how did you describe it?
So we were triggered to do this research based on our own experiences in global health, in inappropriate use of imagery. And one particular example that led us to do this work was a major global health organization which had invited us to put together a presentation for colleagues in East Africa. And when our slide set came back to us, the organization had put their branding, as they called it, on the slides. And they had used images that had no relevance to the topic that we were discussing. There were images of Black women going to church in traditional clothes. And I questioned this with the organization. And I said, if I was talking about this topic, which was antibiotic prescribing and behavior change, to a European audience, I wouldn't use a group of nuns going to church. Where is the relevance here? And how appropriate is it for me as an outsider to go to a group of colleagues in East Africa and use this image to talk about the subject I'm talking about? And we had a lot of pushback from the organization who stated that this was the stock images that they use in global health and they didn't see anything wrong with it. So we decided to go away. I presented this work in one of the lectures I give to a group of medical students at Imperial College in London. And we discussed the issues around this and the biases in representation. And we decided to actually conduct a study to look at how imagery is used in global health. And we sought out the major players in infectious diseases in global health, because global health is very broad. And we identified 14 global health actors who predominantly are based in high-income countries but operate in low-middle-income countries. And we decided to look at the imagery of people that is used in public-facing publications of these organizations. And when we looked at this, we identified over 100 individual publications from 14 global health actors. And within those, there were over 800 images of individuals and people. And we described through a process of consensus, we developed a framework, because what we identified is actually there is no guiding framework. There was nothing to guide organizations and individuals in how they represent people within global health. So we had to go and look at where there were guidelines in Photographers Without Borders and Concord guidelines in Europe for representation of people in photography. And we developed our own framework to analyze these images.
In your study, what are some of the things that you found?
So we looked at over 100 publications that are openly available through 14 global health actors. And one of the key findings was the inequitable way in which people of color are represented, particularly women and children of color from different parts of the world. And we saw an overrepresentation of imagery of children in global health publications, often with no direct relevance or context to the content of the report. These children were often depicted in vulnerable situations without a parent or guardian present, and hardly ever did we see any evidence of consent. And this is something that is of major concern to us, because I work in the National Health Service in the UK. And as part of my work, if I ever went to a hospital and took a photograph of a child, this is a complete breach of medical practice, and I would probably lose my license. So there are very strict guidelines on how we represent patients in the work that we do. And what we are seeing is a lapse of these adherence to these guidelines when people cross boundaries into different parts of the world. And what we're advocating for is that regardless of geography, of race, of gender and ethnicity, people are given the same level of respect and dignity in representation.
I can see how the problem's been amplified when you look for, let's say, a picture of somebody with smallpox or somebody with measles. Because of the rules in the global north, you can't go into hospitals and take pictures of these kids. You end up with a picture of somebody, some little kid in Africa or Southeast Asia or Latin America that's 40 or 50 or 60 years old.
Precisely. And most recently, with the monkeypox outbreak that was predominantly in the global north, we saw a lot of images of black skin being used to depict the manifestations of the disease. And again, that is an example of where we are not adhering to the same ethical standards when we cross boundaries. And this is something that needs to be changed.
And many of these images are probably being used with the best of intentions. People don't mean to do harm.
Absolutely. And what was lacking and what we have added to this environment, to this debate, is a framework to guide the appropriate and equitable use of imagery that depicts individuals with the same respect and dignity and right to consent, regardless of where they are from the world, regardless of their ethnicity, their skin color. There's been a lot of controversy recently about images of people in vulnerable state being used or ending up on stock image libraries. And these are individuals who've been treated by global health organizations. And what we want to advocate for is to prevent this kind of practice. And this requires a concerted effort, not only from those who operate within global health, but those who interact with global health organizations to produce these images and to reuse these images. So we hope this framework that we have developed will be adopted and applied so that we can carry on using imagery, which is very powerful in depicting the problem and finding solutions to those problems, but that this is done in a way that respects the dignity and the privacy of individuals whose images we're using.
Esmita, I know as an editor, one of the problems is this accessibility to the pictures, stock photos, as you say. People don't have access to these freely available images that don't have copyright protections.
Absolutely. And what we are saying, so the next stage of our work is going to be to engage with global health actors, with photographers who operate in global health, to develop a mechanism for possibly recommissioning the images that we use in global health. And it has been really wonderful today. The Lancet Global Health editors have published in response to our paper a pledge to change and recommission images across all of their journals. And that takes into consideration some of the points that we have raised in our framework. And this is a huge step forward. And we are very delighted to see this kind of change happening. And this is what we want from the global health organizations as well, is in having a framework that they can apply consistently to how they represent people who are beneficiaries of the services and of the work that is being done through these organizations.
So the Lancet, a major medical journal, has responded to your study by changing the way they use images and coming up. Tell us again, they've come up with a framework.
They're going to develop a framework within all of their Lancet journals, the whole family of Lancet journals. And this was written in Lancet Global Health. It was published today by the editor and the editorial in response to the concerns that we raised and the framework that we have developed in how we depict people in global health. And this is a fantastic step forward. It's progress.
This is so interesting. I'm so glad that you did this study. It's something that's bothered me for years, and I never was able to put my finger on a solution, and you've come up with a solution.
Thank you. And the reception to this work has been really heartening to us. We've had photographers whose photos we've featured in the work approach us and tell us about the challenges that they face. We've had NGOs and global health organizations come to us. And lastly, this move by the Lancet is really fantastic. And that we're very pleased to see that this work is leading to real change in this field. Thank you.
Esmita, thank you so much for taking the time to chat with us about this.
My pleasure. Thank you for having us.
Listeners can share this podcast, which is brought to you by the One Health Trust, by email, LinkedIn, or your favorite social media platform. And let us know what else you'd like to hear about at owh@onehealthtrust.org. Thanks for listening.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.